I'd like to introduce our next speaker, Anusha Wijeyakumar. Anusha is a wellness consultant at Hoag, where she actively is engaged in championing mindfulness and meditation practices for maternal mental health programs, early risk assessment for breast and ovarian cancer prevention programs, and breast cancer survivorship programs. I also had the privilege to get an early preview of Anusha's book called Meditation with Intention. And I have to say her simple, no-nonsense approach to meditation and mindfulness makes it accessible for all. Anusha, welcome.
Thank you so much, Dr. Lewis, for that kind introduction. It is such an honor and blessing to be here with you all today to talk about meditation for pain management and the science of the breath. So a little bit of background just very briefly before we jump into what I have planned for you all today. I am the wellness consultant at the Hoag Women's Health Institute. I am the wellness coach for the Hoag for Her Centers for Wellness. And it is a great honor to work so closely with Dr. Rob Lewis and Dr. Alison Brooks and lead on all of the meditation and mindfulness initiatives for the Women's Health Institute. And something that I'm really particularly excited today about is our feasibility research study, which is focused on perioperative pain management for breast cancer patients. Dr. Heather McDonald and I, who is the director of our Pre-Viva program, along with Dr. Sadia Khan, who is the director of our breast oncoplastic program at Hoag and our survivorship program, came up with this idea to look into how can meditation and mindfulness, specifically breath work, help our breast cancer patients at Hoag. We are in the infancy of our pilot at the moment, but what we are seeing is some incredibly promising results all through the activation of the breath. We're also studying narcotics usage and really looking at long-term strategies for our patients in terms of integrative medicine and holistic wellness. So, what is mindfulness? What is meditation? These are two of the most common questions that I am asked by patients and clients in pretty much every arena that I work in. So very simply, mindfulness is becoming aware of the present moment, which is right now, not what happened 5 minutes ago, not what is to occur this afternoon, not the constant to-do list that we all have going through in our minds, day to day, what happened on Sunday, what's happening next Wednesday, what do I have to do next Tuesday, and the list goes on. So through your breath, you are actually able to bring the body and mind together as one. And therefore, you are able to practice mindfulness anywhere at any time. And Thich Nhat Hanh, who is a Vietnamese Buddhist monk, who is one of my favorite authors on mindfulness, says, when you breathe in, you bring yourself together, body and mind. You become one. So mindfulness, very simply, is a practice that you can do anywhere. You can do it whilst driving, at work, with your family, perhaps exercising, whether that's running, walking, surfing, biking, even gardening and cooking. So mindfulness is really training the mind to be present in each and every moment. Meditation, however, is different. Meditation is when we ready and steady the mind and body to come to a place of stillness, and we are able to focus on our breath to become present, but really to utilize the practice for deep healing within. We will all actually have an opportunity to practice a meditation at the end of my presentation today. Stress. It's something that all of us are feeling even more so in this post-pandemic world. So what is the impact of stress on our body, on our minds, and how does that relate to pain? So stress causes cortisol to flow through the body. The biochemist Hans Selye in 1936, he was Hungarian-Canadian, and he, through his research, coined fight or flight, which I'm sure many of you are familiar with. And he found that there are two types of stress: eustress, which is good, and distress, which is bad. Both release cortisol as part of the general adaptation syndrome. So this, you can imagine, in 1936 was groundbreaking research that Hans Selye engaged in. So when we're feeling stressed, we very much can often feel like this image, the zebra who is losing her stripes. So she thinks it's stress, but she's not entirely sure what's causing the stress. And there are a multitude of issues that cause stress. Our emotions, pain, our environment, our physical health, our mental health, our emotional well-being. There are so many factors that contribute to stress. And even though pain is a sensation and a feeling, it directly correlates to our emotions, because when we are in pain, we feel stressed, and it releases the stress response in the body. So stress causes pain. Elevated levels of cortisol cause mental and physical pain. There is so much research that points to this. And just again briefly to touch upon what Hans Selye found in 1936, that there are two ways in which we can release these elevated levels of cortisol. Cortisol is a stress hormone, and we have to have a physical release of cortisol to actually relieve ourselves. And there are two ways in which we can do that. And if we are unable to do that, stress manifests as dis-ease in the mind. And yoga is a science of the mind. Meditation is yoga. It's an ancient science, thousands and thousands of years old. Ayurveda is the sister science of yoga, which is also a science, which is thousands of years old. Yoga is the science of the mind. Ayurveda is the science of the body. And it says in Ayurveda that dis-ease begins in the mind and manifests as disease in the body. And when we think about that, of course, integrative medicine and holistic wellness has become more popular modalities to work alongside Western medicine. So what is our solution to stress? Hans Selye found that we have to have a physical release of those elevated levels of cortisol in our body. And there are two ways in which we can do this. The first way is to exercise, and the second is to practice meditation and breath work. Now, exercise is great. That should be a complement of all of our days, our weeks, our lives. But we know that if we're feeling stressed at 9 a.m., and your workout is at 6 p.m., your workout's not going to help you at 9 a.m. What can help you in that moment is bringing awareness to your breath. Now, our breath actually activates the vagus nerve. So when we take an inhale and we force an exhalation, we activate the parasympathetic nervous system in the body, which is the aspect of our central nervous system that calms us. The vagus nerve is the longest nerve as part of the autonomic nervous system. It begins in the medulla oblongata at the back of the skull and ends in the colon. And it's the 10th cranial nerve that interfaces with our lungs, our heart, and our digestive tract. So when we take an inhale and we force that exhalation, we activate the vagus nerve. We activate the aspect of our central nervous system through the parasympathetic nervous system response that calms us. And it's that simple. So when you're feeling stressed, when you're feeling anxious, when you want to manage physical pain, mental pain, emotional pain in the mind or the body, you have to remember to breathe. Now, all of us are breathing, but our breath is unconscious. We're not consciously aware of every breath that we are taking. Pranayama, prana in Sanskrit means your chi, your life force. So pranayama are the breathwork practices that we utilize as part of a yoga or meditation practice. So when we focus our mind specifically on conscious breath work, we are able to regulate the body and the mind into that rest and digest response, which is what calms us. Our blood pressure decreases, our heart rate lowers, our breathing becomes much more rhythmic, deeper, versus being short and shallow, which most of the time our breathing is. So through the practice of meditation and breath work, we are able to reoxygenate our blood, we are able to relieve those elevated levels of cortisol within the bloodstream that, if left unchecked, cause so much disease. I mean, specific things that are related to elevated levels of cortisol in our blood are high blood pressure, hypertension, stroke, weight gain, lower immune function, depression, anxiety, cancer, the list goes on. Stress is pretty much related to so many of the diseases that we treat in Western medicine and Eastern medicine. And one of the most simplistic ways that we can manage our stress and manage pain is remembering to bring our attention to our breath and to live fully in each moment, which we'll talk about a little bit later on. Now, research from the Max Planck Institute illustrated this very clearly. So Albert Einstein was affiliated with the Max Planck Institute. Max Planck himself won the Nobel Prize in 1918 for his theory on quantum physics. There are 33 Nobel Prize winners from the Max Planck Institute in terms of research that they have been engaged with over the years. And they recently engaged in some meditation research where they studied the brains of people that had a long-term meditation practice versus people that didn't. And what they found was quite profound. They found that people that had committed to a long-term meditation practice had more gray matter in their brains. And gray matter is directly linked to how we process our emotions. And remember that when we are in pain, it directly relates to our emotions. And we all know this when we've been in pain, whether it's because we're feeling unwell, whether it's post-operative pain, whatever pain that it might be, we know that we tend to feel more frustration. We tend to feel perhaps sadness or anger because the body is in pain. So we're not often able to tap into joy or peace or happiness without really being aware of mindfulness. And like I said, being present in every moment through the practice of bringing your attention to your breath. And there are countless other studies that have engaged in looking at the practice of meditation in particular, because mindfulness is different, as I mentioned at the outset of my talk today, than meditation. And what we are specifically studying at Hoag through the program that I created, that I've been testing on my patients and clients for the past 3.5 years, that we are now using to study as part of this pilot, is the specific use of pranayama breathwork practices on pain management. And as I mentioned, we're really excited about this piece of research and really excited to look at the results from breathwork, specifically on that perioperative pain management piece. And what we have seen so far, anecdotally, is that it is having an impact on pain medication post-operatively. So patients do seem to be, from what we can see, as I said, this is very anecdotally so far, but we are seeing some promising results with that perioperative pain management piece. So now, let's get ready to do our meditation practice. So meditation can be done really anywhere. I often meditate in my car, and people laugh when I say that, but as a busy working mother to a 2-year-old, my car is a quiet, safe haven. And for those of us that are working from home more because of COVID, it can be difficult to find quiet space in our homes. So what I always say to our patients is find somewhere that works. That can be your car. Perhaps it's your closet. I know that there are patients that are meditating in their closet that we work with. To me, it doesn't matter. We don't need to be ascending to the top of a mountain. What we need to be doing is making sure that we can make meditation accessible in each of our daily lives, because that's how it can work. Not if we're meditating once a month, once a year, or even once a week. It has to be a practice that we do daily. So, the only rule that we have in a meditation practice is that the spine must be straight. That's it. So the cervical spine is long, the spine is in a neutral position. So I suggest that you do this sitting in a chair, legs are uncrossed, soles of the feet are planting, cervical spine is long. Now palms could be gently pressing into your lap, perhaps facing upward, downward, just whatever feels comfortable to you. You have two options with your eyes. You can either have the eyes remaining open, or you can close them. And if you do have the eyes open, I do encourage you to stare at a focal point on the ground beneath you as you begin the process of withdrawing one of our main senses of sight. And just take a moment here to arrive. Gently relaxing the shoulders down away from the ears. Relaxing and releasing the muscles in the face, any tension in the neck, the jaw area. Releasing the point between the eyebrows. Releasing the tongue from the hard palate of the roof of the mouth. And slowly and gently arriving into this moment, into the physical body. Allowing the mind to settle into that place of stillness and of quiet within. Letting go of your daily cares, worries, the to-do list. And just taking your attention to your breath. We are going to begin with 3 deep inhales and 3 deep exhales. So begin by exhaling all of the air out of the lungs, and then begin with a deep inhalation through the nose, and a loud, audible exhale through the mouth. Really sigh that air out. That's what, as I mentioned, activates that parasympathetic nervous system response through the activation of the vagus nerves. Let's do that 2 more times. A deep inhalation through the nose, and a loud, audible exhale. 1 more time, your deepest inhalation yet. And now completely release, letting everything go. If thoughts are coming into the mind, that is completely fine and normal. But just allow those thoughts to drift away like clouds in the sky as you return to your body and your breath. Your body and your breath. Your body and your breath. And I want you all in this moment to relax, because there is no doing this practice wrong. If there are any external sounds, just let them be. And start to notice the shape, the weight of your breath in your body, the rising and the falling. And just notice how your breath feels. Is it long and smooth, or is it short and shallow? Just notice. You're not trying to breathe in any particular way right now. You are simply breathing as it comes. There are no need for judgments or opinions here. If you have them, just allow those judgments or opinions to drift away like clouds in the sky as you return to your body and your breath. Your body and your breath. Your body and your breath. And I want you all in this moment to relax, because there is no doing this practice wrong. You will soon be inhaling for my count and exhaling for my count. So exhale all of the air out of the lungs, and then begin the inhalation through the nose with the mouth closed for the count of 1, 2, 3. Exhale through the nose with the mouth closed for 3, 2, 1. Pause at the bottom of the exhalation before inhaling. 1, 2, 3. Exhale through the nose with the mouth closed for 3, 2, 1. Pause at the bottom of the exhalation before inhaling. 1, 2, 3. Exhale. 3, 2, 1. Continue that breath work practice for 5 more rounds at your own pace, to your own count. So you're inhaling for 3. The inhalation is beginning in the abdomen, moving up through the chest to the crown of the head. And then you're exhaling for 3, and you're feeling the breath descending in the body to arrive back at the abdomen. And as you inhale, I want you to silently repeat to yourself, I am at peace. And as you exhale, I want you to silently repeat to yourself, all is well in my world. I am at peace on the inhalation. All is well in my world on the exhalation. And really allow yourself to feel a sense of peace washing over you in this moment as you inhale. And allow yourself to feel as you exhale that all is well in your world in this moment, regardless of your external situation or circumstance. You are at peace on the inhalation. All is well in your world on the exhalation. Once you've completed your 5 rounds of this breathwork pattern, there's no rush or hurry to get here. You can release it, returning to your normal rhythm and pattern of breathing. So we just take a moment of silence to absorb our practice. Slowly start to bring your consciousness, your awareness back to the physical body. As you feel the weight of your legs on your chair, you feel the weight of your arms on your legs, you feel the weight of your head on your neck. As you slowly and gently blink the eyes open, returning to wherever you may be. So that's one of my favorite practices, and a very simplistic practice that you can begin today. You don't have to remember everything that I've said, but you can simply remember to count the breath. So perhaps if 3 was too long for you, you can always simply do a count of 1. All you have to maintain is that the inhalation is never longer than the exhalation. You are working to lengthen the exhalation. So perhaps you can inhale for the count of 1 and exhale for the count of 2. And as I said, it's so easy when we think about some of the things that I've shared with you all today. Be present. Be mindfully aware in each moment. But if we don't do those things regularly, we're not going to remember to do them when we are feeling under pressure, when we are feeling stressed, when we are experiencing anxiety, and even when we're experiencing pain. So the more that you are able to actually live the practices of meditation and mindfulness, the greater the benefits that you will see in your daily life. So what are the antidotes to stress? Let's recap. Be fully present in each moment. And that's difficult in of itself. Right now, we're being bombarded by everything that is happening in the world around us. And we can give in to feelings of helplessness and hopelessness. But it's really important that we train our minds to be present. And what I mean by that is that we remove ourselves from constantly thinking about the past or projecting negatively into the future. The past is unchangeable. Even what occurred 5 minutes ago, we cannot change. And the future is yet to occur. But I can tell you that whatever you are doing in this present moment will have a deep and profound impact on the future. So bring your attention to your breath as often as you can. Like we shared, when you take an inhale, you are enabled to bring the body and mind together as one, away from the past and away from the future. Meditation and mindfulness helps us to learn to be non-reactive when our triggers are pushed. And perhaps our triggers are being pushed much more now than ever before. So know that. Be aware of that. That's okay if you're feeling more reactionary. I think most of us are. But just be mindful of that. And really practice the 3 central components of a mindfulness practice, which are love, compassion, and non-judgment. And there's an ancient Buddhist proverb that says, we cannot give that which we do not have. So therefore, if I am not feeling love in my own heart and my own mind, I am not authentically going to be able to offer that to anybody else. And it's the same with compassion and the same with non-judgment. So I have to embody love, compassion, and non-judgment to the best of my ability. And that's a really important point to note. We are not monks living in a monastery. We haven't renounced the world. So how do we make these practices readily accessible to us in our daily lives with the stresses and the pressures that we face when we are in pain, whether that's physically, mentally, or emotionally, or we're feeling trauma? We learn to be kind, to be compassionate, and to be non-judgment, and to be aware that our triggers inevitably will be pushed. And the more mindful that we can be of our own pain and trauma, the more aware that we can utilize these practices towards ourselves and others. Thank you so much for joining me today. It has been a pleasure and blessing to be here with you all. And I want to end with a quote by Anaïs Nin. And the day came when the risk to remain tight in a bud was more painful than the risk it took to blossom. I can tell you that through the practices of meditation and mindfulness, you will indeed blossom. Thank you again.